Mama, are you still scared of corona?
Rico, my plan is to enjoy this festive period without fear. Your father and I have been vaccinated.
Mama, this thing is not that serious now.
Now what for you? I'm surprised an educated person like you is talking like this. It is very serious. Have you not heard that the disease is changing into more dangerous
variant, Mama. It is called variant.
When we are all vaccinated, my mind will be at ease.
Mama. Okay, we will get vaccinated. Achoo!
Protect the ones you love this season and celebrate responsibly. Get vaccinated. COVID-19 vaccines are safe and effective.
This message is from the Ministry of Health, Ministry of Information, NCDC, NPHCDA, and partners.
I dodge Jamo.
Obi, what exactly are you dodging?
COVID now.
You are very funny. Is this how you have been dodging every cough and sneeze?
Yes, my guy. The thing don't serious.
Have you taken your COVID-19 vaccine?
Leave that matter for Matthias. I have heard plenty things like...
Beggy, I have taken my complete dose of the vaccine, and as you can see, I am okay.
Why you come still dey wear mask?
To protect everyone from getting the virus. It's good to dey practice the protective measures as the vaccine work now to stop you from dying from the COVID-19 infection.
This your explanation makes sense.
Go and get your COVID-19 vaccine. It is available in most public health centers and some approved private hospitals.
COVID-19 vaccines are safe and effective. Protect yourself and loved one. Take the vaccine. Stay alive. Let us all celebrate safely and responsibly.
Obi the Dodger.
Abejo, I'm going to get vaccinated now.
This message is from the Ministry of Health, Ministry of Information, NCDC, NPHCDA, and partners.
Hello, my name is Mariam Sani Lawal. I work with the Nigerian Center for Disease Control. As a child, I often wondered why people fall ill and why this illness lingers even after treatment. It is this curiosity and inquisitiveness that drove my passion for discovery and change, informed my course of study, and shaped my career path. My role in the fight against the COVID-19 pandemic includes sample management and molecular detection of this virus, taking part in researches relating to the genetic sequencing and participating in a household seroprevalence study of the virus in Nigeria. And as a member of the biosafety team, I take part in training and retraining of frontline health workers on biosafety and biosecurity, drafting of standard operating procedures, and also carrying out optimization, risk assessment, inspections, and quality assurance of laboratories. My advice to youths considering a career in public health is to pursue their dreams, passions, and aspirations. Identify and work with mentors and organizations that share the same ideals, goals, and interests. And finally, they should remain focused and keep their eyes on the prize, avoiding any form of distractions, especially due to gender disparity, inequality, and power imbalances.
Hi, I'm Emmanuel Benyogo and I work with the Nigerian Center for Disease Control as a Health Emergency Preparedness and Response Officer. Growing up, I looked up to my mom as she provided selfless care to sick members in the community where we lived. I wanted to become a medical doctor to continue in her stead. My childhood passion soon turned to a lifelong vision when I joined Nigeria's National Public Health Institute in 2018. In 3 years of being exposed to several trainings within and outside Nigeria on data, public health emergency management, and rapid response, I was set on a course to become an integral part of NCDC with the mandate to protect the health of Nigerians. In the COVID-19 response, I support the incident management team in developing the situation reports day and night for the last 1 year when the outbreak was declared in Wuhan, China. We keep pushing against all odds to collate data from around Nigeria through coordination and state teams, analyze and publish daily summaries on social media and COVID-19 microsite, then explicit reports in the weekly CTREPs. I also work with the National Incident Coordination Center that has led to the establishment of state public health emergency operation centers in 31 states. These PHEOCs, just like this, form the coordination and epidemic intelligence hub for managing information and resources for these public health emergencies. NCDC has provided me a platform to be able to positively affect the lives of Nigerians and the world at large. Thank you.
Hello, my name is Abiodun Egbenu, a medical doctor, field epidemiologist, and the Antimicrobial Resistance Program Manager at the Nigerian Center for Disease Control. When I was young, my mother always told me that I loved caring for people, which piqued my interest in studying medicine. Afterwards, I concentrated on public health and epidemiology. And training materials for health workers on generating accurate data from the point of patient care through laboratory testing to its use at the hospital and transmission of National AMR Secretariat at the NCDC. I also organization where global stakeholders
My name is Nwandu Mba. I am the Director of Public Health Laboratory Services in the Nigerian Center for Disease Control. We are involved in influenza surveillance and then having read some literatures to see that it was a respiratory kind of infection. So we quickly went and dusted pandemic influenza preparedness plan, okay, which we had tried to finalize at the end of the year. So this became like a pointer because the surveillance for this influenza is the bedrock for COVID. Since we already have molecular capacity in place, it is just for us now to get the kits and then start practicing so that we'll not be taken unawares, which we did real time, and then had some kind of capacity trainings done. Then Africa CDC too supported by training 4 of our staff. You know, they went to Dakar and have that training done.
This is where it begins. The processes for the lab. Samples are received here. Every sample that comes here has to be received by the sample reception team. So all samples that come to the lab come through here. It's not just for COVID.
We have received about 31 samples. So now we received 31 samples from FCT already this morning. So we are receiving one again now. So we also told that more are also coming today.
We're dealing with a pandemic virus. Even though it's BSL-2 level containment, we also like to take extra precautions in the lab to work on the BSL-3 containment level. Here we have 2 glove boxes where the samples are inactivated. All samples that come to the lab have to come through here. This is where inactivation of the sample is done. What it means is we render the viruses non-infective here, so whoever is handling them after here now doesn't have to worry about any of the samples infecting them or anything like that. And a lot of what we do here is chemical inactivation.
We divided our staff. Some are coming in the night by 5. Some are coming by 8. So when we come by 8, we start running the samples. And when the other set comes by 5, they will take over the work. So we work 24 hours.
Before the outbreak, we have been handling the Lassa fever outbreak. So typical. But I think the tide has changed. So most times I'm always here. For me, the way I see it, my work is my life. So I don't think it's affecting my personal life. I finish by 5 and I go home. I come back the next day refreshed. So the system is structured in such a way that there is no fatigue and there is no pressure on any individual.
After the sample is inactivated, it goes through extraction and the various rooms for PCR amplification down to reading the results. There is another lab downstairs where part of the work is also done, the research lab, and there are other machines so that we can increase capacity to test more.
Hello, hello. All right. Good afternoon. The Director General, Nigerian Youth Service Corps, Major General Shuaibu Ibrahim, Director General, NCDC, Nigeria Center for Disease Control, Dr. Ifedayo Adetifa, ably represented by Dr. John Oladeji, NYSC directors here present, particularly of mention, we have Ahmed Wada Ikaka, Director Planning, Research and Statistics, Mrs. Victoria Angor, Director Core Mobilization, Alhaji Musa Abubakar, Acting Director Special Duties, Mr. Emeka Mbemina, Deputy Director Press and Public Relations, the NCDC Head of Communications, Dr. Yahya Disu, the NCDC colleagues here present, of course, our supporting partners, the World Health Organization and the Association of Sign Language Interpreters of Nigeria. And of course, our wonderful audience who are the main, or will I say the primary focus for today, the PCM, the Prospective Core Members 2020. To NYSC Batch A, Stream 1, to Safe Camp Reopening Webinar, Suspect 2022. My name is Daniel Walker, aka Dan the Humorous, stand-up comedian, actor, entertainment entrepreneur, and today functioning by privilege and honor as your moderator for this event. If it is okay, can we have a round of applause all over the room? Let's be sure that together we're in it. Thank you very much. Thank you. Thank you. All right. So real quick, we will go straight into the order of the day. We will start with the National Anthem and the NYSC Anthem. Can we have the National Anthem, please? And if we can, please be upstanding for the National Anthem.
All rise, all compatriots, Nigerians come on men to say heroes must join their morning in vain to serve with heart and voice. One nation bound in freedom, peace and unity.
The NYSC anthem, please. Thank you very much. And real quick, let me step into the housekeeping rules. We do not have so much of that, by the way. I'm sure most of us are used to the Zoom meeting room tradition. So please, if you are not speaking at the moment, you should do well to mute wherever you are so that we can have a smooth and seamless communication flow. We will be taking questions, of course, which is the most important aspects of this event, the panel discussion, where we'll be fielding questions, particularly from PCMs. So if you check on your screen, you will see the Q&A part on the menu. Do well to post your questions. We've already had quite a handful before we kicked off. So thank you very much. Immediately, we will go into the first item of the day, which is the address from the chief host, if I must say. Is a man that has had an outstanding career in his military service with over 25 years in the bag, serving this nation and defending its sovereignty, integrity, and unity. And particularly, this man is indeed very, very averse to communication from his first posting into the Nigerian Army Education Corps. And interestingly, about 20 years ago or 25 years ago, he was in this same organization, the NYSC, as military assistant to the DG. And today, he is the DG of this institution. Ladies and gentlemen, as I said yesterday when I got his profile, I was told he was a doctor of history. And just this morning, I was embellished with another information as an associate professor. Please, let's have the DG NYSC for the opening remarks. Major General Shuaibu, PhD, and let me say, how did they say associate prof? ASSCPROF. Major General, sir.
Thank you very much. The DG NCDC, ably represented, Dr. Ladu and our team from the NCDC, my directors and NYC staff at the Yaku Grand House. Honorable Dan.
I greet you, sir.
It's a pleasure to see you live. No, I'm another follower of flatmate. So it's a pleasure. My
Thank you,
patriotic and prospective core members, it's indeed a pleasure and honor to address you once again in this webinar meeting in preparation for Batch A 2022 Batch A-1 orientation exercise built to commence on the 23rd of this month. It has been very, very imperative for the NCDC and the NY to organize such a platform to sensitize you on what is expected of you in the orientation exercise. Of course, you know, in 2020, precisely on the 8th of March, we have got to suspend our orientation exercise on account of the COVID-19. And ever since then, we've been collaborating effectively with the NCDC for safe opening of orientation camps. And we've had over 17 of such exercises, and all have been seamless and hitch-free without any fatality. And that is why you're coming on board. I'm sure you have friends, relations, and so on that have gone through the service here and must have briefed you on the experiences in the orientation camp. And so it's going to be not in any way different. So you are going to follow strictly the non-pharmaceutical protocols, They are going to undergo testing, not testing, you are going to be, yes, you are going to be tested, and only those that are negative, we allow you to come. And if you are positive, you will be forwarded to the state health officials and along with the NCDC for treatment. And I'm happy that, just as I said, we never recorded any fatality. We are going to have a seamless, so all we were expecting of you to do is to take responsibility and adhere strictly to what you are going to be told this afternoon. And you know, and also apart from the issue of COVID-19, we do tell our core members that security is everybody's business. So you must be security conscious. You must not endanger your safety under any condition. Don't get yourself involved in any risky behavior. Under the condition, must you travel at night, and you ensure that you board vehicles at a designated park as recognized by the transport unions. Please don't travel at night. Once you embark on a journey, and once it's 6 o'clock, please cut short your journey and pass the night. NYC is in all the nook and crannies of this country. We have NYC colleges, we have NYC secretariat, we have the military and the police barracks. They will be very willing to accommodate you. Our number will be available, made available to you. Where there are issues, you can always call from wherever, and we'll intervene immediately. So please, once again, take responsibility, be safety conscious, and all the safety non-pharmaceutical protocol that will be given to you in the camp, make sure you follow it strictly, because if you violate it, you'll be decamped. And we'll mean it, we are serious. And I'm happy that we've not experienced such in the past, and it's not going to be anything different. The NCDC has partnered with us effectively, for not for them. I wonder what will happen to the orientation. Many of you have been at home up to now, and then you won't be coming for service. But because of all they've done, we've been able to open accounts, as I said earlier, and things have moved very well. On this occasion, I want to thank the federal government. I want to thank the NCDC for the support they've given to the NYC. And I want to assure them that this relationship will continue to move, grow from strength to strength. Once again, my core members, prospective core members, I want to congratulate you for successful past exams to be mobilized for the service here. Please take our advice very, very seriously. Whatever information you need to hear, please visit NYC platform. Don't go to social media and follow social media. Under no conditions, you can bribe anybody for posting. If you bribe anybody, you are caught, you are going to be dealt with. We are serious. Our posting is free. Don't go and lobby anybody, because there are some scrupulous Nigerians who will come and lobby you and entice you to come. They can change posting for you. Please, it's not so. So follow our platform. Where there are issues, please clear with us. Under no condition should you go to any outsider to lobby for posting and so on. So by the time you come to the orientation exercise, you are going to be given further briefing. I get to know. NYC is a platform for those that are serious. So please take advantage of the NYC, and I can assure you the sky will be your limit. Thank you once again, and congratulations.
Thank you very much, Major General Shuaibu. Please, one more time, a round of applause for DG NYSC. That is indeed good to see you. We hear, or we have heard that you are a great fan of our show. And I wonder how you have the time to watch our show. But I mean, with all the books that you're reading, I mean, on your way to being a professor, you're indeed a man of many parts. And someone who is listening to this discussion, he heard when you said if they don't come, they will be decamped. And when he heard decamped, he had to whisper to me, is NYSC a political party? Because only political parties that decamp. So, you know, and like you rightly advised, you know, core members should not travel at night. You know, so we are here on this platform, not just to inform or educate about health, but also security and also safety. Indeed, it is commendable for the NYSC. We're supposed to be having next up the welcome or the opening remark from the NCDC, but I understand that the DG's rep is yet to join us, and he'll be doing that in a few minutes. So in the absence of that, once Dr. John comes into the room, we will step into the DG's address. So let us move to the next item on the agenda, which is actually, in my opinion, the crux of why we are gathered here today. And measures. We're going to talk about measures in place to sustain the safety of NYSC camps. And to help us with that, the project lead of the Safe Camp Reopening, please let's welcome Dr. Oyeladun Okunromade. Dr. Ladun. Please a round of applause for Dr. Ladun as she takes up the spotlight.
Acknowledge the presence of the Director General of NYSC, our host, and the able directors present here, as well as all our partners, WHO, sign language interpreters, and also to acknowledge all our friends and prospective corps members joining us online. So I'll be taking us through the measures in place at the orientation camps to ensure that we sustain the process of the safe orientation of the camp. Just a minute, we're having the presentation coming on board. Okay, so as a background, the first case of COVID-19 was discovered as far back as in 2020. That was about 2 years running now. And WHO declared this as a pandemic in 2020 in March. Okay. So can we move to the next slide, please? Okay, so it was declared as a pandemic as far back as 2020, and just like DG mentioned, following that, in line with the best practices, global best practices, the country went into a lockdown to limit the transmission of COVID-19 within the country. And due to this, we had a lockdown, shutdown of major businesses, activities, education, and NYSC orientation was also suspended. Following that, when there was a major decline in the number of cases and a better understanding of the virus, the country commenced the phase ease of lockdown and reopening of activities. And we went into a collaboration with NYSC management in conjunction with the Presidential Task Force, then now a steering committee, to develop a protocol and guideline to ensure safe reopening of orientation, NYSC orientation camps across the country, and ensure that this protocol will be implemented across all the 37 camps in the country to ensure smooth running of the orientation exercise. And we work together to develop that, and that is what we have been guiding our activities since 2020 up till today. The objective, the aim of this is to ensure that one of the key activities of this guideline is to ensure that we organize webinar for every streams or every orientation exercise for the prospective corps members to familiarize them with the processes and the expectation for the camp orientation, and to ensure that we inform them of what is on ground and make them understand the roles and the process in the orientation camp, and also to listen to the corps members, understand their concern, and ensure that we address their concern before the opening of camps. Before we go deep dive into the guideline that has been developed, just to give us an overview of what is happening around the world and even in Nigeria concerning this COVID-19. 2 years running, but we'll see the global situation. Being reported within 24 hours up till now, we still record about 1 million confirmed cases across the globe, and about 7,000, averagely 7,000 deaths being recorded throughout the globe. Cumulatively, since this was reported in 2020 till now, we've had over 400 million confirmed cases and over 5 million deaths. These are human beings, and people like us. And on my right, we'll see different countries with the highest number of cases in the last 24 hours. Why this is significant for us is that the core members that we're expecting, we have international students, we have people from different parts of the world that can relate to this country. So they need to know that coming into the camp, we still have COVID across the globe, the region, wherever they are coming from. And the next slide is giving us an idea of the epic curve across different continents of the world. Can we move to the next slide? Where we have different continents, we have Europe, America, Southeast Asia, East Mediterranean, Western Pacific, as well as Africa. This is to show that different continents have experienced different cycle of waves. From the first wave to the fourth wave, no continent has been spared. And we're well coming out of the fourth wave, especially in Africa, due to different strains of this virus keep coming up. Nobody knows the next strain that is coming, and this is to ensure that we need to keep up with the protocols and the guidelines that is already in place to ensure that we keep sustaining these success that we started with. And coming home to Nigeria, as at 15th of February, we have a snapshot of what the COVID situation in the country looks like. We've recorded a total of 254,000 cases, and so far in the country, we've had about 1.2% death related to COVID-19. And also shows a different distribution across Nigeria. This is to show us that every part of the country is not spared when it comes to COVID-19, and the core members are coming from every part of Nigeria. So this is to tell us that your state where you're coming from is not exempted, and we need to ensure that all the protocols are strictly adhered to. The next is just to give us the gender distribution, as well as the age distribution. So you're a male or you're a female does not mean you cannot be infected. And also no age group has been a kind of predilection. No particular age group has been spared. And majorly from this chart, we'll see that age group 20 to 45 are mostly affected. And these core members fall within this age group. This is to give us an overview of what is happening within in the global space as well as within the country. And aside that as well, it's important for us to know that aside COVID, we still have other diseases that we're dealing with. And we want to ensure that our core members are well protected and safe in the camp environment. Lassa fever is it's ongoing in terms of the outbreak. We have outbreak of yellow fever, we have CSM, we also have cholera. This is to give a snapshot of Lassa fever reported cases within the year. So far, we've had over 1,300 suspected cases reported in Nigeria so far, with 269 confirmed cases. And out of these confirmed cases, we've reported 46 deaths. So we should also pay more attention into other priority diseases. Out of these 46 deaths, we have 20 healthcare workers that have been affected so far. And we have our core members that are majorly also healthcare workers. And on the left, we have the distribution of the states where Lassa fever outbreak is ongoing. And if this is not well prevented, no state at the end of the day will be spared. We've worked together with Nysc management to develop the guideline for safe NYC orientation camp activities. This has been recently reviewed to upgrade it to a new version of 2022 in line with new evidences, and also to incorporate COVID-19 vaccines requirements into the guideline. And the essence of today's webinar is to take us through what is expected of us in the guideline, and also to hear some of the questions from the core members as regards this. So first of all, the first important thing is to note that there's going to be a link that will be hosted on every prospective core members portal. This link will take you to a particular page, landing page on NCDC, where you will be asked to fill in your information, where you've been in the last 14 days, the countries you traveled to recently, where if you have any signs or symptoms. And at the end of filling the form, you are going to, by the time you submit, you will generate what we call a verification code. This code is what you take to camp that will enable you to do a test known as the RDT COVID test. And this is what we allow the NYSC officials to admit you into the camp. Without that test, you will not be admitted into the camp. And it's important to know that for those that if you're negative, you proceed immediately to register. For those that are positive, we've also made arrangements in camp to ensure that they are not excluded from the orientation. And part of this measure is to ensure that as your safety is our concern, also to ensure that it's convenient, the camp environment is very much convenient for you. And we also take into consideration that as much as possible, we want to ensure that core members have fun as much as possible within the camp environment. So part of the procedure is to first of all, to batch core members for their resumption. You're going to be giving specific dates for resumption. We expect nothing less than about 300 core members to resume per day. So we want to encourage you to please report in camp on the particular date you are giving. And also, there's going to be a compulsory mandatory rapid test once you enter into the camp. This is to inform you that the test is free. Nobody will require that you pay for the test. And there's been a lot of infection prevention control measures that have been instituted in camp. At every strategic places in camp, there will be temperature check. We have facilities for hand washing, also placed in strategic places, and you're required to come into camp with your face mask as well as the hand sanitizers. In terms of the soap and water for hand hygiene, that has already been provided in camp. It is also important to know that there are holding areas for suspected cases within the camp environment, as well as we've made arrangements for home management of every confirmed cases within the camp facility, and there's been provision of what we call home care kit for all positive prospective core members within the camp environment. We've also worked with the NYSC management to develop different IEC material to ensure that you have knowledge of COVID-19 disease and compliance with preventive protocols. These IEC materials have been placed strategically within the camp orientation campground. All these measures have been put to place. We expected that we've done our part. We expect the prospective core members to also do their part in the camp by ensuring that they take responsibility. And part of the responsibility that we expect from the prospective core member include adhere to the guidelines as much as possible. This guideline will be posted on individual NYSC portal as well. It is expected that every prospective core member will go through the guideline, familiarize themselves with the measures that have been stated there, and ensure that they comply as much as possible. Observe physical distancing within the camp environment. We have limited the number of core members resumption per each stream. And we've also worked with the NYSC management to ensure that we have more camp orientation exercise to accommodate more graduates within in the country to ensure that we prevent overcrowding within the camp environment. It is our responsibility to ensure that we avoid crowding areas as much as possible and hygiene. Where in doubt, please seek clarification at the appropriate channel and ensure consistent use of face masks and also cooperate with officials as much as possible. Also, it's important to know that COVID-19 vaccines posts will be made available in each camp. We're encouraged to take the first dose for those that have not taken at all. Ensure that those that have taken the first dose take the advantage to take their second dose while in camp. And also for those that have completed the 2 doses, we encourage that you take your booster while in camp if you are eligible, because it takes about 6 months after the second dose before you're eligible for booster. But for those that will be in that category, we also make available this COVID-19 vaccine post to ensure that you take advantage of that post-booster. And lastly, it is important that we report early of any symptoms. If you feel unwell, kindly ensure that you report to the clinic officials as early as possible. Lastly, in conclusion, we've done our part, and we charge the core members to also do their part. This would help to foster further confidence in the exercise, in the NYC scheme exercise, in the face of the public, your guardian, as well as the parent. Ensure that we comply with the protocol for safety of all. Thank you.
Thank you very much. Please, once again, can we give a round of applause to Dr. Ladun? That was indeed a very, very, very comprehensive presentation. It began with a historical perspective to COVID-19, where they met, or where the NCDC met the situation, where the world met it, and then Africa in particular. And then, of course, the measures that were taken to mitigate the spread to the very best of their ability, which is very, very outstanding and exemplary, I must say. And of course, to give us the current, empirical data analysis of the situation, the numbers, and the spread, and all of that. And then furthermore, went to emphasize that the fighting and the reduction and limiting the spread of this, not just COVID-19, several other diseases out there, Lassa fever, cholera, to mention but a few, is indeed a collaborative effort. So whilst the NCDC are doing their part, of course, the NYSC doing theirs as well, core members also have their roles to play. So together, we all have our different roles to play. Importantly, as she mentioned, core members, do not be afraid, because I know there's one particular part a lot of core members are afraid of, which is if you feel sick or you feel some type of way, and some of them are probably afraid to go and report because they are afraid of isolation. But I can assure you that the DG has sent me a private note promising that for those of you who report when you're feeling some kind of way, you will not just be isolated anyhow. You'll be taken to a nice place, buffet, free drink, Netflix, enjoyment all the way. So don't be afraid of being isolated. There's a 5-star treatment for those who are coming to isolate. But anyway, it's really key for us to report if we're feeling some type of way, so that we limit the spread of this disease. Moving on, we will now go into the panel discussion. Already we have our panel discussants right here. Forming the panel, of course, is our amiable Director General, NYSC, Major General Shuaibu. And of course, joining the panel as well is her wonderful self, who gave us a very beautiful presentation, the project lead for Safe Camp Reopening, Dr. Ladun, as we fondly, informally address her here. And joining the panel is currently serving core member. He had his camping experience at the Kubwa camp, a graduate of biochemistry from the Al Hikma University, Ilorin, Kwara State. He is Ajinese Aliyu Adebayo. Please, can we welcome him? Welcome him, please, a round of applause, if we can. Ajinese Aliyu Adebayo, are you here? Please indicate with your audio, Adebayo, if you're here.
Hello, everyone. Good afternoon.
Oh, I see you. I see you. All right. So by the way, like I mentioned earlier, wow, we have tons of questions already at the Q&A section. So feel free to drop your questions at the Q&A section on the chat box. We will definitely come to them. So let me start with you, Aliyu. So, I mean, you just, you came out from the Kubwa camp. So with all these protocols in place, the COVID-19 protocols and all of that, social distancing and everything, did you cope? Were you able to, to live well? Let me use that expression.
Okay. Disclaimer, part out of all this, I was also part of the social committee in camp. So I was part of the life of the camp. So to make camp interesting and make it fun, I was the vice president of that committee. So it was a really good experience for me. And with the whole COVID and everything, we still had fun. We made do of what we had, and we were safe. Yes, we were safe.
Okay, fantastic. So, Dr. Lanu, let me come to you, ma'am. Must everybody be tested? Are there exemptions, or everybody must be tested?
Everybody.
For camp to be allowed and be admitted into camp for registration, everybody must be tested. It's important to know that not just core members, even camp officials will be tested before they are allowed into camp. So DG just mentioned also that even DG, even he himself visiting camp will be tested.
Absolutely.
So it's mandatory for everyone entering into the camp to be screened before they are allowed in.
Okay, it's quite understandable, but what about vaccination? Must everyone, or do you have to be vaccinated before you be admitted to camp?
Okay, so I would allow DG to answer that first.
When the last orientation, we gave a directive that all has to be vaccinated before you allow you to come. But with the explanation given by Dr. Ladu now, that even when you are vaccinated, you are still going to undergo test in the camp. So I will advise that even before you can get yourself vaccinated, or when you come to camp, you'll be tested. This is when you are negative, you'll be allowed in. And if you have challenge, you'll be taken for treatment. And at the end of the orientation camp, you'll also be vaccinated. So just make yourself available for vaccination. Dr. Ladu has said it. This is continue to mutate from one variant to the other. You don't know which one is next. So I'll advise that you get vaccinated in the orientation, during the orientation. See, that's what I will say there.
Okay.
That is our recommendation to NYC that all core members should be encouraged to get vaccinated while they are in the orientation camp.
Okay, fantastic. By the way, the questions we have been receiving, some of them are not entirely related to why we're here. So please restrict your questions. Please restrict your questions, but to be fair a little bit, to just carry, and this is the only one time we'll do this in the course of this conversation. DG sir will just hit this straight at you. 2 questions in one. A lot of people are talking about their call-up letters, and then some other persons are asking, is every state in Nigeria safe for mobilization? Are there states that are, off mobilization list right now?
Just as Madam said, there's no state that doesn't have human beings. Even the Northeast, since inception of the crisis, there are core members serving there. All that is expected of our core members is what we have told them. Just play safe. And because we do collaborate with the security agencies, if they advise us accordingly, and we pass this message to our core members to just play safe. Don't endanger your security. You must be security conscious. Where there is not safe, we don't post our COM members there because we are guarded accordingly. You know, the safety of COM members is not something we discuss in the public for the security of our corpus. But all we expect them to do is to just to play safe, and that's all. So where there are issues, we always allow them, and we don't post them there. So they should be very careful. They should not travel at night, because you know in those days, Honorable Dan, when we served, once you are in uniform, you just come out to the road. They give you lift free of charge, but not now, because you are not sure of who that good Samaritan is. Maybe a kidnapper, a ritualist, or an armed robber. So that's why you must board vehicle at the designated park. We have collaborated with Transport Union and paid advocates visit to the road safety on the safety of our COM members. But everybody must take responsibility. It's very, very critical. It's just the issue of the protocol we're talking about. COM members, you must take responsibility by wearing your face masks, get your sanitizers, washing of hands, and so on. So we're adults. Mostly over 25 plus, those that are being mobilized now. So you're adult, so you should know what to do by doing the right thing. Where there are issues, we have a platform that you can always relate to us and will respond immediately. As I'm coming here, I've been chatting with my community, they have my number. I do chat with them. Where there are issues, I respond immediately. So we want to appeal to them. Please, play safe. Play safe. You know, you have to do, faith also plays a role, but we must play safe and ensure that you put yourself, don't put yourself in a very difficult situation.
Okay, General, what about the issue of call-up letter? If we can just address that real quick. A lot of call-up letters coming up in the section.
Orientation commences on the 23rd. I know, everybody has his own date of reporting. They are not going to report simultaneously on the 23rd. Some may report up to 26, 27. So hopefully by Sunday, they will get their call-up letter. Sunday.
Okay, so folks, you've heard it.
On Sunday, you get your letter.
So folks, you've heard it from DG himself. Sunday, you will all get your call-up letters. So I think that puts that issue to rest. So Dr. Ladu, let me come back to you once again. Someone is saying that they are unable to fill their NCDC COVID-19 slip from the link on their dashboard. And what they are seeing on the display is NCDC was unable to retrieve their information from NYSC. So how is there, or maybe will DG be in a better place to answer that, or can you answer that, Doctor?
Okay, thank you for that. That is noted. I'll take the feedback back to our IT team. They will look at the link from the back end and troubleshoot that immediately. And we'll work with the NYC IT team as well to ensure that that is rectified. So thanks for bringing that to our notice. We'll work on it. And before the end of today, that will be corrected.
Okay, so and still back to you, ma'am. When DG talked about anybody, what are the plans for isolation in camps? Do we have isolation units in every camp? Is that the responsibility of NCDC or NYSC?
So at the beginning of the orientation exercise resumption, as far back as 2020, we did what we call need assessment across each camp to actually look at what are the gaps in the IPC measures in camp and what are the things that we need to work jointly with the NYC to provide and make available. And part of that, every camp already has what we call holding area or holding room, where every isolated, every suspected or confirmed will be taken to, and they will be taken care of there. We don't usually call it isolation area because it's within the camp to avoid stigmatization, but it's called holding area, and is the responsibility of both NYC, NCDC, and the state government. Yes, state officials as well as the state Ministry of Health. And there's not been any reported incidents since we've started. And we've also gone ahead to provide NCDC NYC home care kit for COVID-19 in line with the home management protocol for the national. Thank you.
Okay. So I will stay on you for a minute, Doctor. Some of the questions are now around those. Some people are arguing. Let me use that expression to say that if they have been vaccinated, why do they still need to be tested? And then some are also saying, so that we can just merge it all and save some time. If I have taken my first dose, how do I go about my second dose if the time for my second dose is when I'm in camp?
Okay, so the first question on why the screening again. First of all, let's look at there's something we call herd immunity in the immunization. That is when you have majority of the population taking this vaccine to ensure that there is immunity within the population. And if you look at the Nigerian population, we've not even achieved 50%, we're not even close to 50% of the population being vaccinated. So as it is, we need to ensure that we still keep up with the other protective measures. And aside that, study has revealed that COVID vaccine, aside the COVID vaccine immunization, we need to still ensure that we adhere to other IPC measures like wearing of face mask and other non-pharmaceutical measures, because it is not, we've had cases where after taking vaccines, people have still come down with the COVID-19 infection, although with less severity and reduces hospitalization. So as much as possible, we'll still ensure that we screen everyone on arrival in camp. And secondly, in my presentation, I've noted that there will be facilities for vaccination in camp, so as to accommodate those that will be taking their first dose for the first time, accommodate those that will be taking the second dose in camp, and accommodate those that are eligible for booster. It's important to know that the three variants of the vaccines available to us in the country, AstraZeneca, Moderna, as well as Pfizer. For AstraZeneca, after the first dose, 6 to 12 weeks after, you are eligible to take your second dose. For Moderna, after 4 weeks, they are eligible to take the second dose, and for the Pfizer, anytime after 3 to 4 weeks, they're eligible to take a second dose. So for everyone that have taken the first dose, please kindly come to camp with your vaccination card so that it will be updated, and we'll be able to capture it on the NPACDA website as being taken. Yes, Johnson & Johnson, but it's not really available to the general population. It's majorly, NPACDA is looking at hard-to-reach areas and security compromised population, because Johnson & Johnson is just one dose. So it reduces the risk of taking, going and coming for the second dose. And for booster, anyone that's completed the second dose 6 months after are eligible to take booster. So every corps members, prospective corps members that are coming to camp should take note of this and come to camp with their vaccination card. If you don't have your card, then you'll be given the first dose in camp. Thank you. Over.
Okay, real quick, but in the absence, if someone has been vaccinated, I mean, you know how these young people are sometimes, and they forget their cards. I know the vaccination card has this biometric feature. So is there a way you can, maybe just by their names or something, to identify?
I see this. False.
Okay, so there would always be something to show that they've taken the vaccination. So text message from NPACDA is one. There is a QR code on the card that they can scan with their phone. Every prospective corps member has a mobile phone. So sometimes, even if I travel, because it's mandatory now for every international traveler to present their vaccination card, or else you will have to pay double COVID test. So what we do is to ensure that we screen it. We use the QR code and ensure that I have it saved on my phone. So you don't have to carry the cards around. So let them ensure that they have it handy somewhere. Thank you.
Thank you, ma'am. Okay, so Bayo, let me come to you real quick for your other question. Side by side with what Madam has said, in your time in Kubwa at the camp, did you hear, of course, Vice President Social Committee, so your ears will definitely be everywhere. So did you hear of anybody that was tested positive in camp or that was infected in camp? And if there was any such situations from an experiential point of view, how was that managed?
Infected in camp, no. But tested positive before entering camp, yeah, I heard of something like that. And to the best of my knowledge, it was managed because I didn't even think I saw the person. So it was managed perfectly. And then,
so if you didn't see, did you hear?
Yeah, that's the rumor now. That's brief. That's straight by it was not confirmed because anything that is not coming from the camp director or the camp commandant, you cannot place it as a valid news. So it was just a rumor. But we thank God, like throughout the stay in camp, nobody was infected. I think the highest thing you have is your leg was paining you because of too much of parade.
and waking up at odd hours like watch night. Okay, so DG sir, I will throw my last two questions at you. Dr. John has just joined us, and we'll have his remarks from the NCDC right after these two questions, sir. So real quick, someone is asking, I think this is a foreign student, so it's a foreign trained prospective corps member who has completed their registration and physical verification, but yet to get a call-up number. So the person wants to know if the person has been mobilized or not. So
the person will be mobilized. She just monitor a platform. They will get across to him. NCDC, because of the carrying capacity, in line with the directive from the NCDC, we will not be able to mobilize everybody. More than over 100,000 have registered. But those that will be coming to camp in this stream 1, are less than 60,000. So those such people, once we are ready for the next stream, which is March, then they will now get their call-up letter, because we cannot accommodate everybody because of the safety protocol and guidelines as given to us by the NCDC.
All right. So okay, and finally, DG sir, a very interesting one here. Someone is saying that in light of the present situation, fuel scarcity situation right now, and it's very interesting because I mean we are discussing COVID-19, and the next thing, the new grammar a lot of people learned in 2020 was the word palliative. So somebody is asking if NYSC is making any transportation palliative available. I don't know, sir, if you have an answer to that.
I don't have an answer to this one. So the way Amanda report to camp, we're waiting for him. The first situation is improving already.
Oh yeah,
the first is improving already. I just came in now and I saw the queue has reduced drastically. Less than 30 minutes you get forward in the stations.
Okay, so well, if you're the person that posted this, DG has said there's no budget for palliative. Where you are, there's no fuel. I think mobilization starts from 23rd. So if your day is 24th, you can start from this afternoon from where you are and start trekking more. Like DG said, don't travel. So when you trek somewhere at 5:30, you stop, you sleep. You make it. All right. So thank you very much, Gina. Thank you very much, Dr. Ladu. Thank you very much, Adebayo. In a nutshell, like you've heard from everyone on the panel, the issue of call-up numbers and call-up letters, you will get them. Be patient. Be looking at your dashboard. You will definitely get it. It's done in batches. Don't forget we have social distancing in consideration. So that's also another issue. Just be patient. Get your vaccination in time, or be ready to be vaccinated in camp. try to keep yourself as safe as possible so that you don't contact, particularly the dreaded COVID-19, so that you're not tested positive and then you're far from the activities and the fun in camp. And then importantly, if you have been vaccinated, if you can't travel with your card for safety reasons, get the QR code and store on your phone, or keep the NPHCDA text message on your phone. It's very vital. And I think the NCDC, the NYSC deserve a round of applause. Coppers, can you give a round of applause to this? And I think in a copper way, can we even give 3 bosa to NCDC and NYSC? Can we hear 3 bosa? I was wondering how they would spell it on Zoom. All right. Dr. John Oladiji has joined us, representing the... Yes. So, Dr. John, please take us quickly with the remarks from the DG.
Okay. Thank you very much. The DG NYSC, sir, I have to stand on the existing protocol. My name is Dr. John Oladejo. I'm the Director, Health Emergency Preparedness and Response, representing Director General, Dr. Ifedayo Adetifa. So I want to start on the existing protocol, sir. Let me show my face so that everybody will see me, so that they will not say maybe I'm just talking from another area. Okay. So may I start by acknowledging the Director General of NYSC, Major General Swab Ibrahim, the able directors of NYSC present, our supporting partners, the World Health Organization and the Association of Sign Language Interpreters of Nigeria, all other colleagues supporting this project. You are all wonderful. So good morning, all our friends across the country. So I actually welcome you once again to this 7th edition of the Safe Camp Reopening webinar. Like many sectors of the economy, the COVID-19 pandemic threatened this exercise through temporary closure of orientation camps at the peak of the first wave. Like the first reopening of the country post-COVID-19 lockdown provided an opportunity for us to start a conversation on the safe resumption of camp activity nationwide. I'm very excited that despite the constraint of the pandemic, we have found a way collaboratively to ensure that NYSC orientation camp across the country can reopen safely. This birthed the Safe Camp Reopening webinar. The 6th edition have been held so far. So this has been in consultation with NYSC authorities and the Presidential Steering Committee on COVID-19. So we continue to work very hard to facilitate the safe conduct of the NYSC orientation camp activity. A key strategy to doing this effectively is through this webinar, and it's really working for us. This has provided great opportunity to help prospective course members better understand the risk of COVID-19 and the new protocols put in place to ensure your safety. So in addition to this interactive webinar, which I do hope you will enjoy adequately, just to prevent any infection and to control measures that are being instituted to ensure that activities in the camp are conducted safely to not only reduce the risk of COVID-19 infection, but also any other infectious disease. So readiness assessments have been conducted across NYSC camp to ensure that all camps meet the key performance indicator of COVID-19 preventive measures and are ready for safe reopening. This includes a compulsory screening test to be carried out for all course members, officials and vendors on arrival at the orientation camp using an antigen-based rapid diagnostic test approved by the World Health Organization, among other measures. The younger populations are very mobile, and going by our social data, They have the lowest risk perception across age demographics. However, epidemiological data has also shown a high number of infections among these young people. COVID-19 still exists. We need to note that. The daily cases reported across the world is a reminder that the virus is still with us. Therefore, we must continue to take personal and collective responsibility to ensure our safety. The virus does not know the reason people congregate, whether it is for learning or partying, whether it is, also whatever it is, the virus takes opportunity of people coming together and they can spread to any part of the world. Following our review of lessons learned thus far in response to the pandemic, we have strengthened collaborations with relevant stakeholders, including NYSC, so we thank the DG, NYSC for this. As you can see, to ensure that we mitigate the impact of pandemic in Nigeria and ensure associated safety measures are continually communicated across the country. This includes providing safety guidelines for business, schools, airports, and other limits to the spread of the virus. These guidelines are available on the NCDC COVID-19 specific microsite, that is covid19.ncdc.gov.ng. Finally, we must see COVID-19 prevention as our personal and collective responsibility. The virus is still with us, so we cannot go back to business as usual. Please wear a face mask in public setting, avoid large gatherings, especially where public health and safety measures are not adhered to, maintain physical distance of at least 2 meters from the next person, and wash your hand regularly with soap and running water. We remain committed to protecting the health of Nigerians. However, this measure can only be successful in protecting your health if you play your part. I have to thank every one of us that have actually listened to me, and I wish us well. Thank you, and God bless.
Thank you very much. That is Dr. John Oladejo, Director of Health, Emergency Preparedness and Response. Thank you very much, representing the Director General.
Thank you very much.
Thank you, sir. Please, a round of applause once again for Dr. John. And we are gradually winding down, hitting the home stretch. So once again, we will turn our beam to our chief host, the Prof himself, our DG NYSC, Major General Shuaibu, to help us with the closing remarks.
Thank you very much. On behalf of management staff and core members, I want to thank you all, both the team from the NCDC and my colleagues from the Yakubu Brown House and my prospective core members. We have discussed extensively on the safety protocols to follow strictly in camp, and also have also advised on security to please adhere strictly to these guidelines. I can assure you, once you follow these guidelines, there won't be a problem. Thousands of core members passed out yesterday. And why? It was successful because they follow strictly what we do tell them. And I can assure you, you all will not be any way different. All we urge you to please follow and monitor our activities on our social media platform. Don't go and dabble into unnecessary things that will tarnish your name. Don't cut corners. Just be good Nigerians and be patriotic. I can assure you, Nigerians at the place you are going to serve will never forget you, because all of us seated here were all ex-core members, and we can look back with pride that we served our country, and we are still doing so. So please, stay safe. So on behalf of the management again, I thank you all, and I also want to appreciate Honorable Dan. And I hope your quarrel with Mimi. Thank you, and God bless you.
Thank you very much. Please, a round of applause for DG NYSC. Please, there is a poll. Core member, ensure that you participate in that poll. It's very important. It's part of our data collation strategy. So, Lisa, when you mentioned, when you talked about traveling at night, I remember the story that happened some years ago. A corps member went somewhere and she got a female corps member where she got stuck in a city. And then an Okada rider offered to shelter her for the night. And the Okada rider, being a gentleman, when he was in his one-room apartment, put a pillow between them. He respected himself. And he had to pack, was the Okada breathe. Man jumped, stopped the bike, jumped up, and was about to jump fence for the cab. And she says, wait till they go. Ordinary pillow. Ordinary pillow. Now, first you want jump. How could they drive? They go. So, thank you very much. And comments, please, laid out for you. And please take part in them. At this point, this webinar has now been brought to a close to Anthem.
You know the order.
The National Anthem, please.
Oh, okay.
But a lot of can see.
All right, all compatriots, Nigerians come again to serve our fatherland with love and strength and faith. The labor of our heroes was join them on in England to serve with heart and voice. One nation bound in freedom, peace and unity.
All right, thank you very much. Please participate in the poll before we close the room. Yes, thank you very much. All right. Yeah.
Well done, Dan. Thank you all for the good work.